What if the real measure of a nation's heart isn't in its towering monuments or busy streets, but in the quiet corners where its most vulnerable struggle to survive? Right now, in the heart of America, while debates rage over borders and budgets, another crisis quietly spreads: fentanyl, a silent predator on the streets. This synthetic opioid steals lives, tearing apart communities already worn down by inequality.
Politicians are pushing a punitive response that will only make homelessness worse. We need to get these people off the streets so they can start healing after years of trauma of living outside.
Today, we'll take a closer look at this hidden toll, how fentanyl preys on the homeless, worsening a crisis that calls for more than grief. It demands action. Through personal stories and sobering numbers, we'll trace its impact and explore what steps might help us fight back. To truly grasp the crisis we're facing, we need to understand fentanyl, the deadly synthetic opioid sweeping across the nation. Originally developed as a powerful painkiller, fentanyl is up to 100 times stronger than morphine and was intended for tightly controlled medical use. But in the wrong hands, it has become a lethal weapon. Cartels and street dealers often lace fentanyl into counterfeit pills or common drugs like heroin and cocaine, often without users even knowing.
Well, I've been stuck on this fentanyl for a few years now.
What could you say it's been like, being a fentanyl addict?
Oh man, it's a roller coaster. You get your good times and your bad times, but then again, everything in life is like that. You know, jobs, what, you know. But I would say it's a more intense roller coaster than
Just a tiny amount, no bigger than a few grains of salt, can stop the heart or shut down the lungs, leaving almost no time for help. For the homeless, fentanyl can seem like an easy escape from the harsh realities of daily survival.
That's the best way to describe it. It's like you're literally crawling out of your own skin. When you're dope sick, it's like you don't even want to live. You don't even think you're going to live. I just kind of got, wrapped up in it, by taking pain medicine. It just brought me down a dark, dark road.
It's cheap, widely available, and shockingly deadly. Dealers mix it into other drugs without concern for the consequences, turning addiction into a deadly gamble. The result is a sharp rise in overdose deaths, particularly among homeless communities. In Los Angeles, overdose deaths among people without shelter jumped 55% from 2019 to 2021, with fentanyl becoming the leading cause by 2023. These aren't just numbers, they're lives lost in a silent, invisible epidemic. The roots of this crisis stretch back to the early 2000s, when opioids were heavily prescribed, flooding communities with addictive substances. Today, fentanyl flows across the border from Mexico, evading law enforcement and fueling a growing tragedy. In 2024 alone, the DEA seized over 55 million counterfeit pills laced with fentanyl, a staggering figure. But for the homeless, this isn't just a border issue. It's a poison infiltrating the most vulnerable parts of society. Fentanyl doesn't discriminate. It preys on those with nowhere to turn and few resources to survive. By 2024, over 87,000 Americans died from overdoses, many linked to fentanyl. This isn't just a public health crisis, it's a moral one. Each death is a stark reminder of how society can overlook its most vulnerable and the deadly consequences of that neglect. Fentanyl is a silent predator, and facing it demands urgency, awareness, and action at every level. When the noise of political debates fades, the harsh reality of America's overdose crisis comes into sharp focus, especially when we look at the numbers that reveal the tragic toll on the homeless. These aren't just statistics. They are lives lost, families shattered, and communities ripped apart. Overdose deaths have climbed dramatically over the years, from 16,849 inches, 1,999, to a staggering 106,699 inches, 2021. While there has been a slight decline recently, the crisis is far from over. For the homeless, the danger is even more acute, often overlooked in policy discussions. In Los Angeles County alone, more than 2,500 homeless individuals died in 2023, with 45% of those deaths linked to drug or alcohol overdoses. Fentanyl played a major role, appearing in over 70% of these cases. Overall, the homeless mortality rate remains shockingly high at 3,326 deaths per 100,000 people, despite a plateau in recent years. Between 2019 and 2021, that rate surged by 56%, leaving communities struggling to cope with the loss. Similar patterns are seen nationwide. In King County, Washington, overdose deaths among the homeless rose sharply during the pandemic, far outpacing the general population. In Santa Cruz, California, 42 overdoses led to 26 deaths, underscoring the devastating addiction crisis among those without shelter. Although there is a small glimmer of hope, overdose deaths nationwide dropped by 24% in 2024. This offers little relief for the homeless. Research shows that even a 1% increase in homelessness corresponds with nearly the same rise in drug-related deaths. Fentanyl is especially deadly for the homeless. Cheap, easy to find, and often unknowingly mixed into other drugs. These numbers reveal more than a public health emergency. They expose systemic failure, underfunded mental health services, scarce affordable housing, and neglect of the opioid crisis. Homelessness and overdoses are intertwined, a crisis built on society's inability to protect its most vulnerable. Ignoring these statistics isn't just an oversight, it's a moral failure. The lives behind these numbers demand that we face the truth and take meaningful action. When we pause to reflect on the state of our nation, the statistics and policy debates can only take us so far. What hits harder are the real faces behind the numbers, the individuals whose lives have been torn apart by fentanyl, a drug that turns personal struggles into tragedies. These stories reveal the human cost hidden behind the headlines. Take Chris Tawanu from Portland, Oregon. At just 18, Chris was beginning to rebuild his life. He found housing through a nonprofit and returned to community college, hoping to carve out a better future. But just as hope was within reach, fentanyl claimed it. Having aged out of the foster care system and faced the isolation of COVID-19, Chris fell victim to the drug's silent grip. In December 2023, his passing was honored during the Houseless Day of Remembrance, a ceremony recognizing young lives lost to homelessness and addiction, problems only worsened by the pandemic. Not far away in Los Angeles, Michael Flores lived in a tent on Etna Street, doing his best to survive. A temporary stay in Project Roomkey offered brief relief, but fentanyl became his escape, a pill to numb the pain of untreated health issues. Tragically, it claimed his life in 2023. Michael was one of over 2,500 homeless deaths in LA that year. Friends remember him for his quiet humor and dreams of a better life, dreams cut short by the deadly reach of fentanyl. Then there's Ronald Paul Hams, a veteran who spent his days on Skid Row helping others. Armed with Narcan, he saved over a dozen people from fentanyl overdoses. Yet even his heroism couldn't shield him from loss. He watched family and friends succumb to the drug and saw firsthand how it fractures communities. Ronald's work was heroic, but it also underscored a harsh truth. Fentanyl doesn't just kill, it isolates, leaving people disconnected even in death. These stories paint a stark picture of how fentanyl preys on the most vulnerable, those struggling with untreated medical conditions, addiction, and despair. From Angeline Swan in Van Nuys, whose heart disease was worsened by lack of care, to countless others trapped in the cycle of addiction, fentanyl weaves destruction into the very fabric of homeless communities. These individuals are not just statistics, they are sons, daughters, veterans, neighbors. Their lives matter and their stories demand. We ask difficult questions about the policies and systemic failures that have allowed this crisis to unfold. Fentanyl's effects reach far beyond individual lives, shaking entire communities and putting enormous pressure on public systems. This isn't just a personal crisis. It's a corrosive force that deepens isolation, fuels violence, and strains society in ways we can no longer ignore. In cities like Portland and Los Angeles, where homeless encampments are widespread, fentanyl worsens the isolation of the most vulnerable. People retreat into themselves, using drugs alone in motels, abandoned buildings, or under tarps, cut off from support networks that once offered connection and safety. This isolation, compounded by the lingering effects of the pandemic, often leads to unnoticed overdoses, with no one nearby to administer life-saving aid like Narcan. As fentanyl tightens its grip, a vicious cycle of desperation emerges. Small crimes like theft escalate into violent acts, driven by the relentless need for drugs. In places like Oregon, where youth homelessness is rising, fentanyl has only intensified an already fragile situation. Social spaces that once offered refuge, counseling, and human connection are now overwhelmed, underfunded, or shut down entirely, leaving young people and the most marginalized, stranded, and vulnerable. The impact doesn't stop with the homeless. It bleeds into public systems and the broader economy. In counties like Hennepin, Minnesota, emergency rooms are overwhelmed with opioid-related visits, many linked to fentanyl. Healthcare resources are stretched, shifting focus from long-term care to immediate crisis management. In Los Angeles, homeless individuals are nearly 39 times more likely to die from a fentanyl overdose than those with stable housing. The financial toll is staggering, with billions spent annually on clearing encampments, emergency responses, and funeral services, funds that could instead be invested in affordable housing, mental health care, and prevention programs. Beyond money, fentanyl erodes trust in communities. In areas hit hardest, residents feel unsafe, businesses close early, and neighbors grow wary. This isn't an isolated problem. Data shows that as homelessness rises, so do drug-related deaths, revealing how fentanyl tears apart the very fabric of neighborhoods. The question remains, why do we continue to treat fentanyl as separate from the deeper issues of inequality, lack of access to healthcare, and social neglect? Until these systemic problems are addressed, the spiral of suffering will persist, quietly consuming lives and communities alike. At the heart of America's fentanyl crisis among the homeless lies a deeper web of issues: poverty, weak support systems, and a black market that preys on the most vulnerable. This isn't random misfortune. It's the result of years of neglect and systemic failure. Economic inequality plays a central role, with stagnant wages and soaring rents pushing families to the brink. For those on the edge, cheap drugs like fentanyl offer temporary escape from the harsh reality of daily survival. In states like New York, opioid deaths surged during the isolation of the pandemic, with poverty and unemployment driving much of the increase. Evictions add fuel to the fire. For every 1% rise in homelessness, drug-related deaths often follow. Unstable landlord-tenant laws leave people with nowhere to turn, exposing them to the easy availability of fentanyl on the streets. Mental health struggles, frequently untreated, compound the problem. Many turn to opioids to self-medicate, yet the underfunded mental health system offers little meaningful help or long-term recovery options. The black market amplifies this crisis. Fentanyl flows into the country in staggering amounts, often via transnational cartels. Precursors shipped from abroad are transformed into a product far cheaper and stronger than heroin. In 2025 alone, more than 55 million fentanyl-laced pills were seized at the southern border, highlighting the scale of the problem. This easily accessible, deadly drug finds its way into communities, often mixed with cocaine or methamphetamine, sparking fatal overdoses in cities like Baltimore, San Francisco, and beyond. The reach is nationwide, stretching from big coastal cities to small towns that once thought themselves immune. Systemic failures in healthcare and justice make things worse. In the early 2000s, pharmaceutical companies overprescribed opioids, unintentionally creating a market for illicit alternatives. The criminal justice system often cycles drug users through jails instead of providing treatment, deepening addiction, and trauma. Foster youth who age out of care, especially in places like California, face minimal support, increasing their vulnerability to addiction and homelessness. Veterans, too, often fall through the cracks, carrying untreated mental and physical wounds that fentanyl exploits. Fentanyl thrives in this environment of inequality and neglect. It's not just a drug problem, it's a symptom of a society that prioritizes punishment over prevention or care. Yet even in this crisis, hope exists. By addressing poverty, strengthening support systems, expanding mental health care, and tackling the black market, we can begin to reclaim lives and break the cycle of addiction and homelessness. The path forward demands a shift in priorities, from containment to real, lasting solutions that restore dignity, safety, and opportunity for all. As we face the crisis of fentanyl among America's homeless, it's not enough to name the problem. We need real solutions, and we need them now. Hope isn't some far-off dream. It's found in proven strategies that can save lives today. One of the most powerful tools we have is naloxone, the medication that reverses opioid overdoses. In Maricopa County, Arizona, public health campaigns are handing out naloxone along with fentanyl test strips, giving people a chance to detect the drug before it's too late. This simple approach has already lowered emergency visits and saved countless lives, showing how practical tools in the right hands can mean the difference between life and death. Another critical step is expanding access to medication-assisted treatment like buprenorphine and methadone, especially in clinics that serve the homeless. When combined with counseling, MAT treats addiction at its core and boosts long-term recovery rates. Programs in Portland, for example, have stabilized young people aging out of foster care and helped them move toward more secure and fulfilling lives. On the policy side, California is leading with a comprehensive plan that blends law enforcement with harm reduction. The state's master plan has boosted fentanyl seizures while investing heavily in recovery beds and peer support networks, meeting people where they are, out on the streets, not locked away. Federally, the Substance Abuse and Mental Health Services Administration is funding community mental health programs designed to support homeless populations with both addiction and mental health struggles, offering culturally sensitive care. Grassroots efforts are making a difference too. In places like Skid Row and Hennepin County, street medics and community coalitions hand out Narcan, provide prevention services, and offer direct care to those most at risk. These local, peer-led efforts have cut fentanyl deaths and empowered communities to fight back, proving that neighbors helping neighbors can truly change lives. For many homeless individuals, fentanyl mixes with methamphetamines, making the crisis even more complex. That's why the solution must be broad, addressing opioids and stimulants together. The bottom line is action today. Distributing naloxone, pushing for housing, first policies, expanding mental health care, and backing peer-led programs. These efforts aren't just reducing deaths, they're restoring dignity and hope where it's needed most. As these stories and statistics settle in our minds, we stand at a crossroads. Do we allow fentanyl's hidden toll to carve deeper scars into the soul of our nation? Or do we rise, steady and determined, guided by the hope we've seen in harm reduction, smart policies, and community support? From the predator's shadow to the seeds of despair, we've traced a path of loss. Yet along that path, there is light, practical solutions, proven programs, and the power of people working together. The homeless in America, who carry this burden most heavily, remind us that the true measure of a nation lies not in mourning the broken, but in helping to mend them. So let this be our shared commitment, to act, to care, and to change. Comment your thoughts below, support groups like the National Alliance to End Homelessness, and subscribe so we can keep this dialogue alive. In unity, we can break the cycle, not someday, but today.